It's just like, okay, I'm just going to take this one day at a time and do things as they come up. I know that you are incredibly busy and you've got things coming up. And so I appreciate you taking the time to talk
Oh, no problem.
today. I went ahead and hit record because I want to do a podcast with you, but I'm thinking like, okay, she's really busy. Let's record this and then I'll just pull some pieces out of our conversation today
Okay.
and put those together for some stuff if we come
Sure.
across. Okay. So I've never been too familiar with villages. Dealt with some people in Columbus where there are some villages.
There's a bunch.
And when I got involved with Patricia and Steve with Assisting Hands, all of a sudden I started learning about all these other villages over in your area.
Montgomery County is loaded with villages.
Yeah. And I was like, wait, what? And so I was like, okay, I need to look into this more for Hip Connections Hub. And so my marketing manager and I were looking at this going, wow, these are like all over the place, except for Florida up here.
We have 5 in Florida, 3 are
Sure.
in development. I actually, just my call before this was with Healthier West Orange, which is a foundation in, wait a minute, I'll tell you, Winter
What's it called?
Garden. Winter Garden.
Okay.
It's called Healthier West Orange. And they are starting a village. They're actually going to start a hub and spoke with it. I will say that Florida has been a little bit behind the 8 ball in developing. And you don't think that because of the age population, but
Yeah.
you also look at a lot of them are snowbirds. So they're not there year round. And so a lot of them go home in the summer and they do their doctor's appointments and this and that and whatnot. That doesn't say they're gangbusters 100% into developing some of these villages, especially, I'm trying to think of the name of the one. Uplift is one of them. It's really up and coming. It's
In Florida?
Yep.
Where?
Yep. They are in, and they were going to ask me that. I got to cheat and look and see.
That's okay.
So on our village map, you can always search on our website and you can find the villages in different
Because
states.
I was originally looking like I said, I was familiar with some in Columbus because I'd been dealt with some of the senior people over in Columbus. And I knew that there were villages like in Columbus, Ohio. But like I said, I thought like they were like where everybody kind of lives in the same place, like a village. And
Right.
from my understanding for research the last couple of days was that it's not necessarily people living in the same proximity, but having the same ideas and needs and developing a community that can live anywhere.
No,
Am I right or wrong?
I lied. There are 8 villages in Florida.
Oh, crap. Okay.
Several are in development, but several are open, like Wellington Cares, which is in Wellington. They've been open for a while. The one Neighbors Network in Fort Myers, they just opened, as well as the Maitland, Florida one, they've been open. And Neighbor to Neighbor Names in Tallahassee has been open. And then Live Up in Clearwater is open. So they're getting there.
Yeah. Cool. Yeah, because when I originally looked at it, I looked at what's the other website of the founding grassroots group of villages?
That's me.
Is that you? Okay. Because I thought I saw like an original, like a different website. Because when I looked for maps, it was like,
There is a software vendor out there called Helpful Village. Is that what you're talking about? No, we
I just sold drugs that night or something. I have no idea.
No, we were an offshoot of Beacon Hill Village. So the first village that opened officially was in 2002. And they got inundated with inquiries because there was a article that was published in the New York Times in like 2006. And it resonated throughout the country. And all of a sudden, between 2007 and 2009, you had exponentially a group of villages that opened, and some of them in that district, Maryland, Virginia. My old village that I ran was one of the first ones. But Chicago, San Francisco, all these villages are now 15 years old this year, and all because of the beginnings. But and so we do also have some really vibrant regional groups that are still part of the network, but they've formed regional groups. Like Washington has one, it's called WAVE, Washington Area Village Exchange. They have about 85 villages in the DMV. California. Village Movement California is a regional group. They're part of the national network, but they really are concentrating on scaling and doing things within California. They have about 55 villages out there. For the New England, Massachusetts has about 32. Columbus, you mentioned the Ohio group. The Columbus group has about 10 or 12, and Ohio is becoming really a hotbed of great resources. And if you look at it, it's, I think, one of the biggest things. We were going strong before the pandemic, but the saving grace of the pandemic was the resource that villages were able to do when we stayed alive and well, because we were grassroots. Our model is very grassroots, and we were able to, instead of having to depend on this or a person, we're able to call people once a week, or I'm going to the grocery store. And a lot of my member villages divide up their member list, and they'd have 10 people they'd have to call once a week. How are you doing? Do you need anything? I'm going to teach you I'm going to walk you through how to do your telehealth visit with your doctor next week. Things like that.
So are people finding that? So I'm 54 tomorrow, and I'm looking
Happy
at
birthday.
Thank you. I'm looking at, I don't want to stay here necessarily in Ohio for the rest of my life. And I've raised my daughter. She's getting married this spring. I'm like, okay, where do I want to go that will bring joy to my heart? Maybe put me closer to the ocean is my thing. I grew up near the ocean. I've missed it. I want to be closer to there. So I'm looking at areas that possibly have villages, knowing that if I'm going to move somewhere and start over and be alone in that area, do I look at places that are very strong with villages and say,
yeah, sure.
Do I put myself that so I could join something like that and be part of that organization where I develop friends and have people to check on me if they don't hear from me for a week? Did I fall down my stairs? I did that a couple of months ago, and luckily nothing would happen. But I thought in the worst case scenario, should something worse have happened, and my daughter thought, oh, she's just busy, she's not whatever, and didn't check in with me for a little bit, who is going to know that I'm in distress? So looking at that thing, if I needed a ride to a doctor or any of those things that the villages around the country provide assistance with or connecting people with, do I put myself in a position where I have something like that available to me as
I think it's a win. And you also have to look at it the other way, Marianne. I moved here 6 years ago, although I grew up here.
You're in Missouri, right?
No, I'm in New Jersey. I live at the Jersey Shore.
Oh, okay. Okay.
Yep.
I don't know why I was thinking Missouri.
I grew up in Ocean City, New Jersey. And when we started looking at places to move, we weren't going to move. My husband he battled cancer, and
I'm so sorry.
Yeah, I lost him about 5 months ago.
Oh, I'm so sorry.
I know. But I will tell you that decision-making was where my adult children are, which they were all within an hour of here. The support system, yes, I do have family here, so that's great. But I have to say, overwhelmingly, the village that is here reached out so many times. And it's not just about, do you want to join a program? Do you need da-da-da? How about you come and volunteer and be part of a program? We're having this lecture. We're doing this. It was a way to meet new people, because you do adjust when you're alone, when you're starting to live solo.
Right.
And moving to a new community. We lived in Northern Virginia for 32 years. So this is like a new place, a totally new place. And I'm 10 years older than you. And I never think that it's never too late to meet new friends. And I have a host of great new friends through the village, but also through my community. And villages are all about community.
Right.
And neighbor helping neighbor. That's the premise. I love the volunteer first aspect. At the end of the day, many people who are my age are starting to look to retire. I'm not ready yet, but I will be. But at the end of the day, I'm going to want to do something when I retire. I want purpose and maybe to give back. And that's pretty much in a nutshell when you get your volunteers. They want to give back. They want purpose in life. And what better way than to be a part of a community or the community at large?
What if somebody's in an area and they would like to have a village and they want to start a village? How does something like that happen?
We get queries all the time. In fact, I have to get off the call, and when I finish with you, I have somebody who reached out from Tennessee. She saw the model. She's got a group of people that are interested in creating a village, and they want to join the network, our network. We have what we call an opportunity membership, which is basically a developing village. We have a toolkit, we have documents, we have everything you would need to do in a little box, village in a box.
Okay.
And it's from A to Z. But villages are grown organically from the communities they serve. In a nutshell, it takes a group of people with a vested like mindset to say, I really like this. I want to stay in Lakeville. I love this community. I don't want to move to a retirement community, although it's not a bad thing. Many people need to downsize. So that's okay. I'm a former assisted living administrator. So I get the need. I understand that sometimes home is not safe, but ARP did some study about 3 years ago, the percentage of people over 65 who want to stay in their house. It's like no brainer. Duh. Yeah, I get it. How do you make that happen? With support services. As we age, some of us will lose the ability to do some things that we naturally have been doing for years. Thank God my husband had me because he couldn't drive anymore. But let's say, God forbid, I get macular degeneration in 2 years. All right, glaucoma, and I have to stop driving. There's a resource for me. Exactly. Mobility wise, or just the aspect, my mother stopped driving. She didn't want to drive anymore. Fine. But it's also, think about the people who are homebound that really want to socialize. They're really super with it, but they want to socialize. Join programs with them, having friendly visitors. My old village has game night. They have this thing called Cheers, which is, yes, a revolving pub. But it's once a month, they'd meet at a member's house. You bring your own choice of whatever you want to drink and something to share. And they rotated people's houses. And so it was great for those that don't get out that much. They want to share their house off. And of course, everybody wants to rubberneck in a new house. You want to see what their house is like. And it's a great way to socialize. And that brings you to the other premise of villages. It's not just the support services that volunteers offer as far as transportation and the honey-do list and things like that to help somebody in their home, but it's the socialization. It's making sure that people are not isolated, that they're not lonely, that they are engaged. And that's about aging. And we all experienced it during COVID. We all got a taste of isolation.
Is there an age limit to join?
Some villages do have, but my village didn't. We had a very intergenerational program. We had some folks that were disabled as far as intellectually, and they could still be mobile, but they lived in their own home. They just needed support services and driving or whatnot. And they may have been in their late 50s but no.
Do you have to join a village to be a volunteer?
No.
So somebody younger, say in their 20s or 30s, could volunteer to go help seniors.
We have lots. The only thing we do, we have programs that have people who are under the age of 21 to interact, but we really can't do background checks on those volunteers. So it has to be in a group setting. Let's say there's a cleanup day, or let's say I always got some of my high schoolers, they always used to call me all the time. Yeah, Mrs. Sullivan, I have service hours I need to do. What do you need? Them 40 hours by the end of the week. Great. But we would do something at the library, teaching a group of older adults how to do Facebook, or, how to upload a picture from your smartphone.
I spent 20 years doing that, by the way.
And that's, what everybody, when the iPads came out, there was such a rash of, let's give mom and dad an iPad. And
they didn't show them how to use it.
Going, how do we do this?
Yeah.
So teaching them technology is a huge component. And that's, again, we really do the intergenerational aspect of it. But yeah, we have younger folks. We have people who are working. It really was a blessing for a lot of our volunteers because people were working from home and they needed to get out. They're the ones, the younger group were the ones that could go to the grocery store. And so they were doing grocery shopping for their neighbors. And there was a system in place. We'll give you the cash, or we'll give you the credit card, or whatever you needed to do. Every village created their own system, but it worked. And you know what? It made the older adult happy, but it also made the volunteer happy because they were doing something purposeful.
And so some of this stuff is volunteer, like grocery shopping, perhaps if you have them or whatever. Some
Right.
of the stuff I was reading on the website maybe isn't volunteer, like they get connected with a service that can come out and replace a ceiling fan or do plumbing for them or stuff like that.
So
Use
yeah, we
vendors.
always, yeah, my village had a growing list of local vendors that were reputable. I wouldn't say vetted, but it would be like member to member. Oh, I've used
Right.
Broadley's Plumbing and Heating. And we also had this great hardware store in town called Village Hardware, believe it or not. And they had a list of handyman that they vet. And so we would just call the owner of the hardware store and, can you give me 3 names of, some carpenters that I can pass on? Boom, done. Our volunteers, the honey-do list was replacing a light bulb, placing a washer in the toilet,
Yeah.
whatever. Simple things that the door hinge is falling off or whatever. Simple things. Because there's a lot of folks, that's me. I would volunteer to do a handyman. I have an extensive toolkit. That was my gig. I'd rather go to a hardware store than a grocery store.
Same.
So that would be no hardship for me. Helping to get the flowers out and the flower pots out because they can't lift them. Or how about at Christmas time, getting their Christmas decorations out of the attic so that,
Or
the
putting them
base-
back up there.
or putting them back up. So the handyman, the honey-do list was really a great byproduct, and it actually engaged men more because they, again, felt purpose, especially the retirees. Every volunteer throughout the villages are background checked.
Right.
So villages have to carry liability insurance. They also have to carry an umbrella policy for their volunteers that go into the house, but also drive.
So is that something that you set up for groups that want to do this, or do they?
No,
have to
they
go out
do
and
them
that their own?
individually. They have
Okay.
to do it on their own because every state is different.
Right.
Every state's insurance structure. And I can shout out 2 that are extremes. And one is California and one is New York. They have Vermont's another one, extensive insurance laws.
Okay.
What we do is tell our villages, and it's part of the toolkit, we tell them, call the Alliance for Nonprofits. The ANI will direct you to a broker that's in your state that's local. And if you go through them, they usually give a discount to nonprofits. So also, it's peer to peer. So let's say a village in Ohio is starting to form. I always say we're going to connect with other villages because they're going to have some nuances within your state that we may not know about. Connecting peer to peer really works, for us. Same was in Virginia, where we had the resources. And it's not just that, it's 99% of our villages are either in 501c3 or in a parent sponsored 501c3. So they're all nonprofits. And so they're doing donations and grant writing. And again, the nuances state to state are different. Ohio has great resources as far as foundations. I know that Ohio State has been supporting a lot of folks.
That's probably why there's so many in Columbus, villages in
Right.
Columbus.
There are a lot. The Benjamin Rose Foundation is very supportive of many villages in Ohio. Likewise, Archstone in California has given a lot of money to Californians. Villages.
So do all the villages come through you to get started with this initiative?
Not all. Many of them start on their own, and not all of them still remain a member. We're still very much a mom and pop organization. The national network is twofold. It's a village commons where they can get resources and the documents and get started and attend. We have webinars every month. We have one on a mentor webinar to help those that are developing. We have a vulnerable members group, which is a very popular webinar. It's hosted by our village on Capitol Hill in DC. And it's our aging population, how to help them when they become beyond what a village can do, the capacity, and how to help them as they age in their homes by getting resources and whatnot. We have some software companies that we host webinars because they basically do the back office management and volunteer management aspect of villages. But then we have specialty, lectures. We had a lecture on insurance. We had a lecture on dementia. We bring in the resources. But then the other part of what the national network does is advocacy. We're very much involved in state, local, and national advocacy. And I'll give you a good example. The Older Americans Act money is up for reauthorization this year. It has not been updated in, I don't even know how many years. It's been a long time. And so the comment period ended back in August. They have another small one. But the Older Americans Act monies, federal monies, goes to things like Meals on Wheels, to Medicaid services and whatnot. What we did was, in our comment area, we want them to redefine direct services, because right now direct services are doctors, physicians, physical therapists. We're doing direct services through the villages. We're doing transportation and the friendly visitor, the meeting the social isolation part of, where instead of having somebody come into the home. Not that we're going to get very far, but it's a comment period. I think it's worth the conversation, because home and community-based services are doing more outreach than some of the silos that they had before. And I think COVID really taught us that we can't be silos anymore. We all have to work together within the community. So we'll see. Other advocacy is prescription drugs, the Caregiver Act, which is on the desk of many of our federal legislators. A lot of families are out of pocket money because they have to take time off of work because of caregiving.
Right.
And you said yourself, we took care of my parents. My mom had ALS, so it was long haul. But we never had to take off time. But if I had, it would have been out of pocket costs. Redefining the caregiving and reimbursement, especially for families that have multiple families living in their homes, big. So those are areas that we are touching on and hopefully making an impact from our grassroots level.
So a group of people get together. They say, okay, we want to do this. They reach out to you. What are like initial startup costs to be involved in you? And you've told me like legal stuff and whatever that you guys don't take care of. What do you take care of for people, if anything, other than
most people,
process?
yeah. So the first, I'd say, year, there's no spending money. It's more about, unless you want to spend money to do a needs assessment within the community. But the first thing that if you've got 5 people that got together and said, we really like this, we're going to do this, we're 10 people, whatever, you divide up. What are the areas that you have to look at? Talking to existing aging services, whether it's your area agency on aging, whether it's a local politician. It's doing a survey of who's in your neighborhood. Who are you serving? How many people are over 65? What existing services are there out there? Do you already have transportation? There's some towns in Massachusetts that they don't need transportation because the city takes care of all their transportation. They have a
Right.
city bus. Oh, good. So you can check that off. You don't have to worry about transportation. Governance. How do you want to be governed? Applying for that 501c3. So that does cost money. It's nominal. You can usually find an attorney that will help you pro bono.
If you're smart, you go and you find a senior attorney to be part of your community and work
absolutely.
those services, the people
Right.
that have those skills and licenses into your community. You're like, hey,
Right. No,
what
it's
is this?
true.
Yeah.
And it does take, you have to do articles of incorporation and this and that once you get to that point. But the fees are pretty nominal. When you start looking at, and it's growing a business, you have to look at a business plan. Are you going to be an all volunteer village? Or do you want some staffing? Or are you going to have an office space? Or will somebody give you, a lot of our villages have been given office space within their community.
Yes.
Some are in churches. My village, so we roped in a county supervisor back in 2007. He loved the village idea. And so he had a town hall meeting for us and we handed out surveys at that town hall. And it was quite popular. And then once we started really launching, it took us 2 years. He found office space in the public library in a room that nobody had. It was like probably a janitor's closet, but they emptied it out. It was big enough for 2 desks and we were very happy. And today it's still there.
Nice.
So in the public library. Yeah.
Do you
So-
have documents that walk people through what
Mhm.
do I need to, the steps
Yep.
that I need to take in order to do this?
Yep. There's a checklist. The toolkit is we've been working on it for about 9 months because it's about over 10 years old. So we really needed to beautify it,
Yeah.
streamline it, make it condensed. It was bulky and cumbersome and some redundancy. And so my staff has been working on it for the last 9 months. And they've done a great job. I haven't had to touch it. I'm the last person to touch it. So several of my board members who have been in the industry for a while, in a part of the village. And then we're doing some exit polling with some of our developing villages. What did you find useful? What didn't you find useful? What would you take out? So we're in that process right now. And then we'll send it to a graphic designer to beautify it and it'll be done. It'll have links and some of the links.
And there's a cost to that toolbox, right?
No, you have to join as an opportunity member, which is $200 a year.
Okay.
And the toolkit and all the documents are free.
Oh, nice.
Yeah.
Okay. So that gets them started. And then they can come back to you for other services that you also charge for?
So we have the mentor group that meets once a month, but also we have other villages throughout the United States, village members who mentor one-on-one developing villages. All you have to do is request. Simple things like I need somebody who knows something more about governance. I need somebody to walk me through. We're doing this handbook and whatever.
I just reach out to you if they're struggling.
Oh, yeah.
Get this off the ground. Can you help us out?
Actually, I have a call sometime I'm waiting to hear with the Philadelphia group. And it's not unusual, but there's developing a village. There's a couple of villages in Philly. But this is one over near, I'm trying to think, the northeast corner. And there's 3 groups that are working on this, and they've come to a standstill because they don't know where to go next. They're doubling on each other. And so I'm going to be talking with them. And also the best is it probably is going to be in person. I'm about 45 minutes away from them. I'll probably set up a meeting in person to sit down and try to help them through it.
I think that's wonderful because just like any small business, right? Sometimes you just get to the point where you're like, okay, I think I know where I should go next, but I'm not 100% sure that's the right direction. Or maybe I have no clue what's next and why this isn't performing.
And that's, I mean,
and having someone to bounce his ideas off of.
Yeah. But every village goes through this stumbling part of it. And how you're going to, the first thing is how you're financially going to be sustainable. Many of our villages have some kind of dues structure, annual dues structure.
What does that usually range from?
Anywhere from $50 to $900. It just really depends.
Okay. Because I thought I saw one in Union County. I think it was like, I want to say it was like $200, $300, $400 a year or something like that. I thought that was so phenomenal.
And so my old village charges $750 a year annually. And the reason they came up with this number is because back when we didn't have Uber and Lyft, to take a cab to the doctors was $15 or $18 each way. That's once a month, twice a month. And what about grocery shopping? To take a cab to the grocery store. And so they were really reliant on transportation.
Thank God there's food delivery these days.
I know. But here's the thing. Transportation still is about 60% of what our villages do.
Okay.
You still have the requests. And let's face it, if I needed an outpatient procedure, I'd be looking for somebody to take me home.
Yeah. No. Are there any villages in Dayton, Ohio that you know of?
Yeah. You know what?
Because I might go volunteer a couple times a month to go shift for people around some.
Let me see.
Because I have people that I was talking to. A big thing of mine is like Hip Connections is taking vetted businesses that have the heart and the soul to serve seniors and connecting them with their caregivers and their family members to help them and the seniors that need it, but also connecting them business to business. And I've got businesses that are involved with us all over the country. But last week or a couple days ago, I was telling someone that I was going to be meeting with you and she had all these questions. And I'm like, don't know. I will find out. Like, how do businesses get involved with being one of the vendors for villages without coming across being spammy and Like, how do they get involved with that? Do they
I
volunteer
mean,
and
I can only
get to
say
know
from my
people?
experience, we did have a list of vendors, but mostly it was member to member. They would recommend, but we would vet local businesses, and it would require to make sure that they were legitimate, they had a business license. If they would give a discount to our members, reliability. We also had, a thing called the Washington checkbook, which we could check on them. The county also has services where they, check off the vendors to see if they're reliable. The other thing is we never gave out one name. We always try to give two or more. And that would go in line with home health agencies,
Right.
somebody who may need an aid at some point. Two or
Insurance
three.
preference
Right.
for that. Right.
And we are very careful to say we're not endorsing this
It's a
particular
recommendation.
Right. It's a member recommended this, found it very reliable. Why don't you try them out and call them? But as an endorsement, we can't endorse one over the other.
Okay. So if not she, but if in general people wanted to get involved with villages somehow, get to know the people, volunteer,
Yeah, get to know. Yeah,
do stuff.
we have a lot of realtors that do that. They want to sell their house eventually, I'm sure.
Or downsizing
Yeah.
services or stuff like that. You were looking up Dayton. Did you find one?
I didn't find any in Dayton. There was an inquiry recently with Dayton. I don't think it has come through yet, but
What about Cincinnati?
yes, we have Cleveland, Hudson. Where's Hudson? Athens, Marysville, Columbus, and South Houston. I thought we had Cleveland. No.
Mhm.
Oh, Cleveland. Did you say Cleveland?
Cincinnati.
Oh, Cincinnati. No, we don't have Cincinnati.
Oh, bummer. Cleveland's 4 hours from here. It's a good distance.
But I hope that it catches on. There's a lot of conversation in Ohio right now.
Yeah. And I want to help continue that conversation because I think it's a brilliant idea. And like I said, I'm not sure if I'm staying in Ohio or not. There's no ocean here. But I just think in general, being able to help get the word out and to even tell people, because when I've asked people the last couple of weeks that I've been poking around this, I've been looking into this. Hey, do you know what a village is? And they're like, you mean I spent 6 months over in the UK and villages are small towns. And I was like, no, not like a village of people that have the same common needs, like seniors, like whatever. And I'd explain it to them as best as I could, as knowledge I had. And they were like, no, I've never heard of that, but it sounds really awesome. And I think the more people know about it, the more inquiries you all are going to start getting as far as.
We always find an uptick so there was an article, something happened in LA, and all of a sudden our social media explodes, which is nice. It's great. And I've been on a couple podcasts. I'll be interviewed. I'm heading on Sunday to California for the American Society on Aging's conference, which is in San Francisco. Apparently I'm being interviewed out there. So
Nice.
it always is an uptick.
Was I right? Like, you do not live necessarily in the same neighborhood. It's just being in the same community or group of people.
And that's a great question. I have villages that are 4 square blocks, a high rise, or 14 square miles. You define your village and your catchment area as you look. We have villages that are HOA. We have villages that are faith-based. They come out of a church.
High rise, not necessarily everybody in that high rise would be part of
Not
the village.
necessarily. Exactly. They can choose. There's one in Oakland, California. It's Section 8 housing, and they created a village.
However, they could create potentially a high rise with that designation of being a village, and part of moving into this high rise means you're automatically the expectation is that you're going to be part of this village. It's
Right.
like the Wild West still. They could just decide what they want to do, how they want to do it. And as long as people agree to that and the rules are set in place.
Right. And I think people who live in high rises, and we had an apartment after we sold our house in Old Town just before COVID. And I swear I never saw any of our neighbors. We were on the, 9th floor. People just come and go. They don't interact. And I think it's harder when you're in a house and a neighborhood, people outside, you wave, you see your neighbors, you're walking. High rises are different. So
Whatever.
But I think it's harder to socialize unless you have plan social activities, but it's a great way to get people connected. You have no idea whether it's starting a bridge group, having a theater group that goes to the movies once a month, or
Does it have to be senior based then? Could it be
no, it can be anywhere.
a group
No.
of 30 to middle age, 30 to 50-year-olds?
Yeah, starting a village. If it's a reciprocal thing, and the nice thing is there's a village in Reston, Virginia that's time banked. I'm taking you to the airport, so I banked an hour for if somebody can come and help me flip my mattress.
See, I need that. I always wait till my daughter and son-in-law come over to be like, hey, while you're here, could you help me turn my mattress around? Because it's king size and it's heavy. But yeah. So
Want to know how to create
the
awesome
ideal
videos?
situation with that,
Check out
though, is
MyShareRay.com.
within a
You
certain
can do
set
it
of
too.
square mileage
Titles.
requirements, right? Because of having people that are available to come take you places or
Not
deliver
necessarily. Yes and no. The
Hello guys,
challenge
welcome
with
to
some of
today's
our
video
rural
by Trust
communities
Stanley,
is
and
that
this is a TS
it's
Tech Talk
far and
video,
wide.
guys.
My
So
village
on
here at
today's
the
video,
shore,
I'm going to show
they're
you how
doing
to
Cape and
invite
Atlantic
someone
counties. Then
into a live
I have
stream.
to
So
cross a
you are going to be
bridge in order
going
to get
live
to my
with
house.
two different.
I live on the bay and the intercoastal's right here. And I'm 100% sure that's going to be closed tomorrow because of the northeast storm we're getting. If I wanted to go to the biggest local, there's medical services down here, but if I really wanted if I had God forbid, a diagnosis of something and I needed a big medical center, the closest one is an hour away. The same with people on Cape Cod or Long Island, your medical services, and think about people who live in rural communities. They're traveling an hour to get to a doctor's appointment. But that's the beauty of neighbors. Everybody's in the same boat.
Right.
And it's a neighbor helping neighbor. I'm going to take her today, but maybe I might need help next week, doing, if you're going to the grocery store, it's 45 minutes away. Can you get my groceries? It's a reciprocal.
Do people tend to, hey, you just drove me an hour each way to go somewhere, I'm going to give you gas money? Do they do things like that? Is that
No,
just
we really frowned on that. Yeah, you can buy them a cup of coffee, but volunteers can, deduct their mileage at the end of the year.
Right.
But some villages have paid staff to drive. I know that my village here at the shore has paid staff. They decided not to have the volunteers. So it's a cost if you go offshore. I think it's $10 round trip to pay for it. But our dues are so low, people will pay that to go to the grocery store or whatever.
Okay. Totally fascinated by the whole concept and the different possibilities of
Oh
it
yeah,
all.
there are many similarities with villages, but they're all very different because it really is organically grown from your community. So
Right.
what your needs in a community might be different than other. And like I said, transportation is a really good example. Social programs might be an example where they don't really have a senior center or place to go or congregate meals or you name it. So
I love that. I love that. I was reading one of them was like part of the thing was like meal sharing and stuff like that, which fascinated me because like I said, especially like if you relocate somewhere and you don't like, I am seriously considering moving to North Carolina, but the politics there, I think might drive me crazy. I don't know yet, but I want to be somewhere.
you know what? My office manager said the same thing. She moved from Northern Virginia. They were a little worried. They moved to New Bern. They love it. They love New Bern. They think it's a great little town.
New Bern. Yeah, that's one of the places that I'm looking at.
She moved there the year after. She's been there 5 years now.
Okay. And she loves it.
They love it.
Oh, that's awesome.
And she was worried about the politics too, but she's not worried.
Really? Okay. Yeah, I don't know. It just still seems a little backwards. And I don't know if that would drive me crazy or if the fact I really don't care because I just want to be closer to the ocean.
I get it.
Than
That's why
Ohio.
I'm here. And I'm 2 blocks from the beach. So,
Yeah, I grew up in Jacksonville. When I was a teenager, by the time I got my own car and stuff, I was back and forth between the ocean. It was like a 30-minute drive. But back then gas was 99 cents a gallon, but I was only making $10 an hour. Right? So it's all relative. But yeah. And I was talking to my mom recently and I said, I really don't want to live in Florida again. I said, but I'm really missing the ocean. She goes, you've always been that way. she also told me that I was like talking about like being employed by people and stuff. And I'm like, that drives me crazy as far as not having autonomy and being able to check in on my own hours as long as I'm doing my job and stuff. She's always been like that too. It's like stuff like I found out that my mom's entire side of the family all got married at the age of 25 or older. And I was like, you could have told me this when I was 19. Like I would have not stayed with that alcoholic asshole and just done my thing. So obviously some of this is definitely
So
going to be cut out.
where does your daughter live?
She's here in Dayton.
Oh, she is.
I guess it's been a year, maybe a year and a half. December, I think, was a year that she graduated from Wright State with her bachelor's in psychology. And so she's looking at where she wants to go for her master's right now. She works at the Children's Hospital in the trauma ward.
No,
She goes out and deals with kids that are in trauma, like out in like schools and different stuff like that. And so she does that. Her fiance works at an emergency room as a tech, but he's decided he doesn't want to do that either. So he went back to school for anthropology.
Oh, wow.
So who knows where the two of them are going to end up, but I don't think it's going to be here in Ohio. And I told her, I said, I miss the ocean. There's so many things that I miss. I'm like, she's 26 now. I said, I've spent 26 years completely humbly devoted to everything you. And I said, and I'm 54 now and I'm single again. And I just want to figure out what it is that I want to do with the rest of my life. And so when I started learning about villages, I was like, I'm recording.
That's good.
We're good.
I like it. And so you'll like this aspect. I was just do you know a gal by the name of Judith Graham?
I do not.
She's with, I can't think of the name of the organization, but she writes nationally. She's got a website and blog and everything. She was doing a piece on solo aging and she put something either on Facebook or whatever. And she defined it as somebody who's never, this is ARP's definition too. Somebody who's never married, doesn't have any children, and is aging alone. I'm like, I don't agree with that. I don't agree with that. I don't agree with that definition.
What did you say? Spencer?
No, just that you've never married, you've never had children, so you're aging alone. So you're a solo ager. And I'm like, I don't agree with that because now I'm a solo ager. My children don't. I live alone. I had to readjust living alone. How about
there's nothing wrong with that either, though.
No, there's not. No, but it's interesting. Villages are really supporting solo aging.
Yeah.
And I said this to this Judy Graham. I said, think about all the LGBTQ plus folks that are out there. They've been aging, and alone. They may have had children, but my adult children don't live near here. I love them dearly, but if I'm going to see them, I have to travel. Who's making decisions for me in my house? Me.
Yeah.
What happens at the end of the day if I need transportation tomorrow? It's on me. Or I need somebody to help me move something. Got to wait for one of my boys to come.
Yeah.
Yeah. Right. Which
I had to have surgery.
They're coming next Friday so they can flip my mattress.
I had to have surgery a couple of years ago, 2019, right before COVID. And it dawned on me that when you're single, whether it be because you're widowed or because you're divorced or because you've never been married, whatever the case is, that those decisions seem so much more daunting when you're by yourself of not having. And I was able to talk to my daughter, but at the same time, I made her go to the doctor appointments with me. Hey, be my second set of ears. Listen to make sure that I'm hearing things correctly and I remember things. But then also so that you can help me make this decision because like I was having to decide, I had a cyst this big on my left ovary and do I take one? Do I take both? Do I have a hysterectomy? What do I do? And before, like when I was married, I'd be having that discussion with my husband. And I was like telling the doctor, I'm like, look, I'm finally single. I've got a boyfriend. I'm having really great sex for the first time in my life. Now you want to put me into menopause instantly in one day with a surgery. And those kind of decisions when you're by yourself
are daunting.
Really hard, very daunting. And so even these groups, like I would imagine that being part of a village is also having a say in that village of what that village looks like. Are there a lot of widows? Are there a lot of single women would a support group of grief or whatever the case may be, if there's a lot of people, middle-aged people that are making those kind of decisions and
Right.
whatever, let's get together once a week, once a month,
It's a
whatever the
support
case
group.
is,
It's instant. Yeah.
a Facebook group or whatever, and have
Right.
this and be able to create this and have instant friends, or not, it's not like add water, have friends, but you've got to
Right.
develop those relationships.
Yeah.
It's harder as you age as well, but having these people in commonality is huge. But also, we're talking about women being single. And if you'll just look at the numbers of it, the
Oh.
number of women that stay single at middle age and up is huge. They're starting to be like, I'm not putting up with crap from men anymore.
Yeah.
Not male bashing
Right.
men. That's not what they're doing. But I just don't want to anymore. And finding good women friends and support out there is crucial. And
It
so
is very
having,
much so. Yeah.
and I would imagine also that villages that are supportive to their members, where if you join and it's not necessarily like a high-rise building neighborhood type situation and you just aren't fitting in, you've given it 2 months or whatever, maybe they have a refund policy to where find
A
another
lot
one.
of them are months to months type of thing. She just pay monthly. I know that.
Like,
One of somebody was on a call yesterday, said they had a monthly fee. Oh, yeah.
we're like, join for a year and no, we're not gonna.
I think they give you a discount, but yeah, I have to be cognizant of my time. Sorry.
That's okay.
I have a 3 o'clock coming on. So
Okay. People want to get in touch with you. Tell them tell them your website. They can get all your phone number and all that from there.
B2B at b2bnetwork.org is our email, but also Village to Village Network,
And I'll put
our
that
website.
in the stuff.
Most
Thank you.
certainly. Yeah,
Thank you
definitely.
for spending time with me today. I
Oh,
appreciate
thank
it.
you. Have a great weekend and enjoy your birthday.
Thank
Enjoy
you.
your birthday and move to the beach.